As COVID continues to surge in Nevada, state leaders are starting to look at whether recent mitigation efforts have had an impact on the spread of coronavirus. Kate Houston has that report.
It's been just over 3 weeks since Governor Sisolak announced Stay at Home 2.0. The 2-week initiative was put in place to try to bring down the surging numbers of COVID-19 in the state. On a Wednesday call with Nevada Health Response, the team addressed the drop in COVID-19 cases from this time last week and whether or not that's a result of recent mitigation efforts. Caleb Cage, the Nevada COVID-19 response director, says it's important to look at these numbers in terms of trends over time.
There's always a 2 to 3 week lag when a case is identified and when we start reporting them. There is also a 2 to 3 week lag for when we start to see mitigation measures, or when we could start to see mitigation measures take hold.
Cage says they're unsure if the decrease is due to a lower number of people getting tested over the holidays or from any changes in who went to get tested.
It certainly does not include any of the impacts that we may or may not see from Thanksgiving. So all of that is to say, yes, a decrease in 1,000 cases is positive, but it is too early to call this a trend or to even see what the causes of that might be.
With this in mind, it may be a few more weeks before we start to see the effects of statewide mitigation efforts, including the recent statewide pause put in place by Governor Sisolak. Kate Houston, 8 News Now.
Nevada Health Response announced updated CDC guidance on quarantine periods. New guidelines state individuals can go back to normal activities after a 7-day period if they tested negative starting on day 5 of quarantine. This also applies to individuals after 10 days if they are asymptomatic and testing is not available.